Alright, so we're going to use some McKenzie exercises for the treatment of lower back pain, and the idea of these couple of exercises is to get the pain more centralised, so for patients suffering from like sciatica type symptoms where it's radiating down into one of the legs. This example is going to be the right leg. We're going to try and centralise it more to the lower back. Alright, so firstly we're going to get the patient to lie flat in a prone position. We're just going to get them to relax here for about 30 seconds. The first thing we're going to get them to do is come up onto the elbows into a bit of an extension. This is to try and get the pain more centralised if it's a posterior bulge. Hold this for about 30 seconds, go back to neutral, and then we're going to extend a little bit more up onto the hands, a bit more extension, get the patient to pay attention to whether the pain is going from the leg back into the lower back. And this is a good send home exercise for the patient. If the patient is displaying signs of like antalgia, where if the pain was in the right and they're kind of like leaning away from it and forwards, we're going to use a side glide exercise to try and centralise that pain. So if the pain's in the right hand side, we want to be standing about 2 feet away from the wall, feet together, and we're going to have the left side against the wall. And then we're just going to bring the hip, we're just going to allow the hip, the pelvis, to slide towards the wall, hold that for a count of about 2 breaths, and then back. And we're just going to do a few reps of this. If the patient is finding that too painful, we can get them to go into a bit of flexion, so about 10 to 20 degrees flexion like that. Just repeat the exercise until they're ready to go into full extension. So that's just taking the hip to the wall again, all the while making the patient aware of whether that pain is centralising from the legs up into the lower back.